Good morning, everyone. I'm Megan Cullip, along here with Scott Micklem.
Good morning. It's Friday once again.
I always breathe this. I feel like I'm always sighing, like a sigh of relief.
I think another week, and here we are.
I know.
Yeah.
I mean,
we
time
made it.
passes,
Another
which
week.
I don't like, but Fridays are great.
That's true.
Yeah.
Very true. And on this Friday, this is our COVID-19 Friday. We're doing the COVID-19 program every other Friday, of course, as folks know, to still get information out to the local community. Next Friday will be our Solutions from the Street Friday.
Yes, it will.
So it'll be a different focus. But this morning we are talking about COVID-19. And, of course, one of our very favorite guests who is here to talk about COVID-19 and give us an update is the one and only Dr. Bob Underwood from Salmon Regional Medical Center, right? And he's on the phone.
He is on the phone. He's part of Team SJRMC.
That's right.
They call them.
There you go. Dr. Underwood, good morning.
Good morning, Scott. Good morning, Megan. How are you?
I'm well.
Yeah.
I won't speak for Megan, but I think she's okay. She
both,
made it to Friday.
We're both well, yes.
Yeah. So
indeed.
Thank you for being with us yet again. And let's start, I guess, by just giving us a quick update on conditions at the hospital. We've seen kind of case numbers rise, and I think I saw that they may be falling a little bit, but you tell us how things look today.
Yeah, absolutely. So, yes, the hospital is full, but it's not necessarily just COVID patients. In fact, for the last 3 days, the number of COVID patients that we've had in our hospital has been flat. It hasn't changed at all over that time frame. Some people going home, other people being admitted, but it's not increasing, which is the part that we're trying to make sure stays that way. But our overall census of total patients is actually quite high, in the 160s as of today. So it's not all COVID patients, though. It is a number of different pathologies, injuries, the kinds of things that we take care of as a hospital all of the time. So busy hospital, but nowhere near where we were back in our really big surge of COVID. We're at about 32 patients right now in the hospital. Now, of that, 9 of those patients are in the ICU. 9 of those COVID patients are in the ICU, and 7 of them are on ventilators. So that still shows that it's a very serious disease. There's no denying that. And the acuity of that patient, of course, makes it not very many patients, but a lot of work behind those patients, a lot of severity behind those patients. As we've talked about before, but not every listener may know, that we have an ICU, kind of what we call a step-down unit, which is for patients who don't necessarily need that level of care. And we've had to convert that into another ICU. And we do have some ICU-level patients in that area right now as well. So busy as a hospital, and some proportion-wise, some pretty sick people, and those are some of our COVID patients that we're seeing. Another question that people have is, are they vaccinated? Are they not vaccinated? The answer is what we have been seeing at our facility is about 15% of our admitted patients are vaccinated, which means 85% of our patients are not vaccinated. So a very significantly higher proportion of patients who are not vaccinated end up in the hospital, and they are the ones also who get sicker than the other patients that we see. It's protective from hospitalization with COVID, and it's also protected of severity of disease if you have had the vaccination.
Very good. And so speaking of vaccines, we have heard a lot about the third shot, the booster, and I feel like the information's gotten a little muddied. Who needs it? When should they get it? How long after the other 2 doses? All of that. So maybe you can unmuddy the waters for us about this third shot.
Sure. As much as I can right now. Now, the FDA heard the research a week ago, so last Friday, about the third dose for the Pfizer vaccine. And so they were looking at all of the data. What we have seen, and we're still waiting for a final report to come out, but what we've seen about that is there is a recommendation for people, not for everybody, to get a third dose. It is for those who are immune suppressed, those who are elderly, which are people who are likely to get more ill from the disease, and then also for those who have a higher risk of being exposed to COVID. Healthcare workers, of course, falls into that category. For them to get a third dose, that is a recommendation 8 months after your second dose has been administered. And I know, Megan, that you like to geek out on the science, but the long and short of
Yes.
it is the type of antibodies that you develop from the vaccine and how those wane over time. And so that's where the recommendation of the third dose has come from. Like I said, we're still waiting for the official report to come out and the official recommendations, but that's what we understand the decision to have been made.
Got it. And it seems, Dr. Underwood, that everyone is saying we need kind of more time to study the effects of these boosters on the rest of the population, but it seems to me that eventually we'll probably start seeing those notifications and decisions about boosters for populations younger than 65 and the other non-high risk professions and maybe things along that line. And I guess the other part of the question is San Juan County and the state already has an infrastructure in place to give out the vaccines, doses 1 and 2. So I would assume when it's time for a booster, that setup will continue to go pretty well for anyone who wants a booster or is eligible for a booster. That's what I'm trying to say.
And I think that that's absolutely accurate. If history, in terms of what is processed so far, plays out again, then yes, we would anticipate that would be a natural progression of the recommendation, is that it will be more broadly recommended. And of course, we're going to be ready to accommodate that. We've had now several rounds of vaccine administrations to practice, and we've gotten pretty good at it. And I think even with the first release, we did very well at getting the vaccines out to those who were eligible for the vaccine as quickly as possible. And I think it will just be improved above and beyond that, just because we've had the ability to test that infrastructure and know how it works well.
Very good. And so one more shot question, but this is different. This is the flu shot because we're heading into flu season. I know last year flu season was almost non-existent, but I presume that's because everybody was masking, washing their hands, and staying away from each other. But now that things have kind of changed a bit, and so flu shot, do we recommend? And what about when it comes to the possible overlapping of the COVID vaccine? Is there a period of time to wait between the two?
No, they can be given simultaneously if it happened to fall in that pattern. So there is no conflict between getting the regular flu shot and the COVID vaccine. And yes, if flu season is coming about, and the CDC recommends that people get vaccinated for the flu, preferably by the end of October. It takes about 2 weeks for the vaccination, just like any vaccination, about 2 weeks for antibodies to develop in the body and provide you the full protection against the flu. So, we don't want anybody to delay getting their flu vaccination. And I think you're right. Last year, because of social distancing, wearing a mask, the influenza never got an opportunity to really get a foothold in any community. There were very, very few, like I've never seen before, reported influenza cases across the state or really even across the country, which is great. We don't expect we'll be that lucky this year because, the patterns have changed. So, and in fact, we encourage everybody to get a flu shot. We will be holding 2 drive-through clinics here at the hospital. This is for adults only. One of them will be on Saturday, October the 23rd, and then again on Saturday, October the 30th. We'll start around 9 o'clock in the morning, and they will run till noon or until we run out of vaccinations. So we really, really recommend getting the vaccine. Again, that's adults only. It's first come, first serve. It's really done at a drive-through. All of the important information is available on our website. So that's sanjuanregional.com, and it's free. So we're committed to keeping the community healthy. So we really recommend people come through and get their vaccines that way. I had family members who did it last year, and it's so fast and simple, it's not even funny. Drive through and get your flu shot, and you're on your way.
There you go. You guys have it down to a science, if you'll pardon me saying. But yeah. And Dr. Underwood, I want to ask you about I guess while we're on the flu and flu vaccine, because the season was so almost non-existent last year, do we know, normally I think we track some of this stuff from the Southern Hemisphere of how bad the flu season will be in the Northern Hemisphere this year. So do we even know what they were dealing with over their winter to even know how to prepare for this flu season?
So I would say that the amount of data is less than it would normally be, but we do have data around strains that have been running in the breakthrough cases. And it's based off of last year's information, but also some on the year before that. So, in the end, on average, the flu vaccine has an effectivity on average of about 60 to 65% in terms of being effective against the strain that's there. I've been around healthcare long enough to have seen some years where the coverage was fantastic and other years not so good. So we think we'll still be in the window of where it has been in the past. But that's a question that's been asked several times is, what are we basing it off of if there was no flu? And the answer is it's not that there was no flu. It's that there was very little of it. Which is encouraging. Nonetheless, we do have some basis on which to that the powers that be at the CDC will come about with this year's recommendation. In fact, it's already being distributed. So that's where they came about, getting all of that information and making sure that we had the right strains covered.
Very good. And let's talk variants real quick. I mean, the last time that we had a doc on, Dr. Brad Greenberg informed us that pretty much if you have COVID at this point, it is the Delta variant. There is talk about the Mu variant. Is that going on? Have we seen that? What's the status there?
No, we have not seen that. So, of course, they changed the way that their naming was from the country. Now they're following the Greek alphabet. The Mu variant is out there, but we're not really seeing anything like that here. And Brad is spot on with his commentary that if you have COVID right now in the state of New Mexico, it's the Delta variant. We haven't really seen anything over, and it has absolutely dominated the variant profile that they're running on the positive tests that we're seeing in New Mexico. Now, there's a couple of others that are of interest, so they're kind of watching what they're doing. But again, the only thing that we're seeing or worried about right now is Delta.
Got it. And that's a good point, I think, Dr. Underwood, is to say that there have been other variants that have gone through the Greek alphabet so far, up to this point. They just haven't taken off like this Delta has and had the transmissibility rates and some of the other things that this Delta variant has, which has made it just so dangerous and so worthy of study and precautions against, correct?
Yeah, that's absolutely correct. So the CDC has a way of classifying these as variants of interest and variants of concern. And so the ones that are of concern are kind of what you just described. They can be more dangerous, more virulent, have a possibility of evading your immunologic response to previously being infected or from having a vaccine. And the other variants haven't moved out of the variant of interest into the variant of concern. To kind of put it in their categorization process.
Great. Well, Dr. Underwood, thank you so much for joining us today. As always, we so appreciate, geeking out on the science. That's what I appreciate. But also just
the... You should have seen her.
You should have seen me. It's radio, so you can't, but you should have seen me.
Yeah.
And just unmuddying the waters. There's so much information out there. Some of it is valid, some of it is not, and it's helpful to hear somebody who knows what they're talking about. So thank you.
Yeah, absolutely. I appreciate being on. I appreciate being able to reach out to the community. You guys have been great partners with us to try to make sure that we can get information out to the community that we're really here to try to protect and care for. So we greatly appreciate you as well.
Well, we're happy to work with you and continue the partnership. So thank you very much, Dr. Underwood. We'll talk to you again soon.
Yes, sir.
Thank you very much. That's Dr. Bob Underwood from Salmon Regional Medical Center.